the county governments must be allowed to come up with what they really need based on what they lack in the hospitals. So if I lack incubators, please do not give me expensive equipment for bigger things that might not be what my issues are. So let the county governments...
Now that you brought up the issue, let's first of all listen to what the Senate committee has had to say about this medical equipment, if we have those voices, so that we can carry on with the conversation.
Equipment was delivered to Kakamega General Hospital at night on a Saturday. We refused to receive them. And then all chiefs were told to go to funerals and say, Oparanya has refused equipment, that's why people have died in Kakamega.
Even if the leasing of equipment was noble and was going to be beneficial, it cannot be a gravy train where we shroud it in mystery. Nobody wants to answer questions.
We constructed a hospital using 135 million shillings. 450 million shillings, and you have not seen a document. You have not seen the contract. In a county like Trans Nzoia, half the hospitals do not have the equipment. They are still in stores. Some of them are still in boxes, never been used. This is a fraud. This is corruption. We must say no to it. Okay,
all right. They show a very poor image of what has been happening, but I know there are some counties where the equipment has been working. So, for instance, Naivasha District Hospital. But so when you look at this, yes, you're saying that the counties are not given an opportunity to choose what they want, but really, money was spent. Money is being spent. How do we make get value from that investment?
I think that when listening to that clip, I think Kenyans confuse something. The fact that you have built a hospital with brick and mortar does not make it a hospital. It is the services that they render, the lives that they save, the diseases that they cure that makes it a hospital.
Right.
So it's not the brick and mortar. And that is why you've seen that there are in other cases where we've had, you know, flying doctors still saving lives. They don't have a brick and mortar. So we are too focused on building and painting and having big signs and a nice core values written on the wall. It must be, at the end of the day, your performance indicator must be how many lives you have saved, how many patients you have attended to. In fact, as hospitals even advance, it's how quickly you can attend to a patient and send them to specialist care and make a correct diagnosis. Because you could see many patients but make a misdiagnosis. So it's about what are the performance indicators of each and every hospital.
I think the whole reason why we got into devolution was so that we could get more specific, you know? So if, for example, I come from Kisumu, if malaria is the biggest issue that we have, give the governor an opportunity to deal with malaria, but don't come up and give me a cancer equipment and force me to spend all my money paying back for that equipment, and I'm ignoring what's really killing my people. Then devolution is not worth it.
So did we devolve health too early into the devolution?
No. What I'm saying is we must let the needs come from the bottom to up. The national government cannot decide that Kenya is one and you all need cancer equipment, for example, and then cancer equipments are brought and everybody now has to deal with it and spend all their money leasing or paying for the equipment. When the other diseases that can actually be sorted out and the other diseases that are paralyzing the citizens in those particular counties are ignored at the expense of those equipments. For the first time, I really support these governors because I smell corruption there.
And so, Janet Oko, so what do we do? I mean, they
first for me, counties. I think that anywhere, and especially where we involve ourselves, you know, the politicians, we will always have struggles about procurement. Let's face it. We will always have struggle if we are not the ones who have bought, you know, and so on. So it's an expected thing. But I think for me, and listening to Mheshimiwa speaking about how well counties understand the health sector, noting very well that health was just devolved the other day. Right. I would expect naturally that the national government understands more, having been with health, you know, the whole time. So there's something that we're missing here: good faith, which has been our struggle throughout. That this is my forte, this is my docket, the Constitution has given me this, and so anybody trying to come in should first come to me. And meanwhile, the citizens are struggling, the citizens are dying, and so for me, we've really moved so high in terms of saying this is your responsibility and this is your blame. And looking at the health ministry, for example, the health CS, how can we make sure? Because at the end of the day, the buck stops with the president, and the president's person is a county, is a cabinet secretary, for example. Right. So where really are our accountabilities? And as citizens, that is the most important question. We do not care who does what. Our problem is, has it been done? I think that for me is the most important aspect.
Honorable Shilei, my question is still unanswered because we are talking about, the Senate has said that they are recommending that no further payments should be made for the equipment. But you and I know that's just a dream because the money is deducted from the treasury. So we have equipment that is not under use. How do we get value for money? Do we take them back? How do we recover the value that has been lost?
When you've already gotten into an investment and you've made a purchase, even in your own homestead, you have to reevaluate how to use it. So you may find that a certain county has certain equipment and does not necessarily use it, but there's another county which probably has high use for that same equipment. You can move that equipment there, so we can do something and still be able to mitigate the losses that we've made as a country on that one. But moving forward, what I'm more interested in is moving forward as a country, what are we doing? But again, as Janet has put it very well, the whole management of the health sector has been riddled with, people are more interested in where is the cost center, where is the procurement being done. And a very good and recent example, and many people may not agree with me on this, but I know one day I'll be proved right. And I think, and this was also a challenge for the Parliamentary Committee on Health, the Jomo Kenyatta University Hospital, the one that has recently been built, I think 600 beds, top of the state-of-the-art, very well thought out. They've been working on it for many years, from the time when Professor Mugenda was at the helm there. Chancellor. And they had proposed that they would like to run it as a university hospital institute. The way you have the London Hospital, the way you have McGill Hospital, the top universities in the world as run as a university hospital. Why you have dedicated staff, you have research continuously happening because you've got a pool of researchers and people working and studying disease control and so on. They proposed that they would run it like that. But do you know what happened? There was an executive order which now says it shall be run just like Kenyatta National Hospital. So I said, if we have been doing it using that method, why is it that we couldn't try another method and see if it works? So, but it's all wanting to centralize the power. And so there's a lack of innovative thinking in the way that we manage also our medical services.
My solution is so simple. Right. Because I'm a simple mind. I'm a governor.
You're a great mind.
I'm a governor. Babies are dying in my county because I do not have, most of them for some reason are born premature, and I don't have incubators, and I'm not able to pay for my power or whatever. Please, if that is what I think is the most crucial thing in my county that I need to deal with, give me an opportunity to deal with it. That is what devolution is. Don't tell me, here, their equipment, now pay, so that I don't spend any money to sort out the basic problem in my county. End result is, the machines or the equipment you've given us will not be of too much use because of other reasons, and my babies will still continue dying. So what I think the solution is, government has to let go in some of these areas. And if they want to still have control, let them have control, but based on what is coming from the counties, the needs that are coming from the counties, so that government is not the one that's deciding, you need this equipment, we're spending this much, so you pay at the expense of what specific problems that specific counties have.
All right, your final word on this, Janet, before we take a break.
I'm saying that unless the national government really comes up with, I'm saying national government because that is where, the buck really stops. And even with all this arrangement that the health belongs to the county and so on, there's still a lot that needs to be done in terms of capacity building the counties. I am one of those persons that do not believe that some counties can actually manage this sector the way it is supposed to be managed. And therefore, I am asking, can the health CS, for example, come up with accountabilities And I know some of this will say, no, we are elected by the people, but I think that is not it. It is not about a competition. Let's face it, people. We are not doing well in the health sector, and therefore there is need for us to relook. For example, critical questions I want answered, and I'm looking at whatever report that I can be able to get. Let me know, how much have counties spent from the amounts of money they collect? How much have they spent on improving some of these facilities? It cannot just be that counties are just going on and on and on, and the reason being that we are the people that understand the plight of our people the best. I mean, that is not about it. The thing is, what have you done with the resources that have been given? Strict accountability that tells us about 13% or 10% of your budget you're putting in the health sector. That way, I think we will be responsible. Improving
the facilities, not just on the outlook, but also on what is in there. All right, so we take a short break. Of course, we're speaking to Gladys Boshole from Uasin Gishu, Rosa Boyu from Kisumu, and Janet Ouko, how do I say? Formerly a CEC at the Nairobi County. So we take a short break. On the return, we'll be talking about money and education. Members of Parliament have a housing allowance. There are several questions being raised on several counties on how they're spending money. Questions about how national functions are finding themselves in budgets of counties. We'll be talking about that when we return.